Dear students, welcome to Medical Physiology. I am Dr. Michu Malakar, lecturer, Department of Physiology, Sarsolimula Medical College. Today, I am going to discuss with you the cardiovascular systems, which mainly includes blood pressure and total peripheral resistance. That is the topics. For the benefit of the students, mainly for the foreigner students, I am going to have this lecture throughout the class, mainly in English. Sometimes I will use Bangla for the benefit of Bengali students. Now, as you know, to get easily understanding of blood pressure and total peripheral resistance, firstly you need to know about the cardiovascular systems. We all know what it is comprises of: right ventricle, left atrium, right atrium, the vena cava systems, aorta, artery, there is the pulmonary artery, and the pulmonary veins. You all know in anatomy. Now, you need to know also the circulatory systems, that is the arteriolar circulations and the venous circulations. Now, most important thing for cardiovascular system is to know what about the diastole and the systole. In diastole, heart is relaxing state, and systole, heart is in contracting state. Now, firstly, we need to know about the blood flow through the blood vessels. It has got two determinants, that is the two factors. First thing is pressure difference of the blood flow. Actually, you can call it the pressure gradient, which mainly comprises the difference between the pressure between the two ends of the vessels, which is the force that pushes the blood through the vessels. And the impediment to blood flow through the vessels is called vascular resistance. So we got two things, that is the pressure difference and the vascular resistance. With these two, the flow through the vessel can be calculated by the formula which you already know in the intermediate state, Ohm's law, that is F equals to delta P divided by R. Here F is the flow of blood and delta P is the pressure difference, and the pressure difference between the two ends of the vessels, and R is the resistance. So using this formula we can know the blood flow is directly proportional to the pressure difference and blood flow is inversely proportional to the resistance. So students, can you answer me if I ask you what about the resistance? So I can tell you resistance equals to delta P divided by flow. Yes. Now two more things you need to know about this is velocity. Velocity equals to, that is velocity of blood equals to flow of blood divided by cross-sectional area. As we know, the blood flow, also you can say that blood flow equals to velocity into cross-sectional area. In case of blood flow, the cross-sectional area is going to be more in some cases. Where this cross-sectional area is more, the velocity of the blood flow will be less. So which area? We know in case of capillaries there is more cross-sectional area, but in case of aorta this cross-sectional area is lowest. So as I told you, cross-sectional area more, so velocity will be less. So we can say less velocity in the capillaries. What is the importance of this? This helps to exchange the substances. This slow flow rate helps to good capillary exchange. Now comes to laminar flow. As it is, you can say it is a linear flow, the flow of blood in straight vessels, like the flow of liquid in the narrow right tubes. Now comes to laminar flow. The flow of the blood in a straight blood vessels like a flow of liquid in the narrow tubes is normally laminar. Within the blood vessels, an infinitely thin layer of blood in contact with the wall of the blood vessel doesn't move, and the next layer of the blood vessel is of low velocity, and the next is higher velocity, and so on the fourth and fifth. So velocity being greatest in the center of the stream. Exactly, the laminar flow occurs at the velocities up to a certain critical velocity. So after that critical, it is turbulent. Laminar flow is silent, but turbulent flow creates sound. Next, we are going to discuss about turbulent flow. Normally, this is a pathological one, and when the normal laminar flow, that is a streamline flow, there is occlusion, there is turbulence, which produces the heat and actual perfusion pressure changes. So when the rate of blood flow becomes too great, it passes by an obstruction in the vessel. It can make a sharp turn. When it passes over a rough surface, the flow may become turbulent and disorderly rather than streamlined. Turbulent flow means the blood flow crosswise in the vessel as well as along the vessel, usually forming holes in the blood. These are called eddy current. These are similar to the whirlpools that one frequently sees in the rapidly flowing river at a point of obstruction, you see. And then again, tendency of turbulence of flow increases in directly proportional to the blood flow and the diameter of the blood vessels and the density of the blood, and inversely proportional to the viscosity of the blood. This total is the equation which is known as Reynolds number. It is abbreviated like this: VdP by eta. You can see R is the Reynolds number and the measure of the tendency for turbulence to occur. V is the velocity of blood flow, and D is the vessel diameter, and the next this is the density and the viscosity. So in this Reynolds number, what is important, this Reynolds number rises above 200 to 400. Turbulent flow will occur at some branches of the vessels, but it will die out along with some portions of the vessels. However, when Reynolds number rises approximately say 2000, the turbulence will usually occur even in straight smooth vessels. But Reynolds number for flow in the vascular system even normally rises to 200 to 400 large arteries, and then turbulence of flow at branches of these vessels. In the proximal portion of this aorta, or say in the arteries, Reynolds number can rise to several thousand during the rapid phase of the ejection, during the ventricular phases. Now, this is Poiseuille's law. It is important. Actually, এটাকে যদি একটু বাংলায় বলি তাহলে র্যাপিডলি যে ফ্লো থাকে সেন্ট্রালি, এটা আসলে বলতে গেলে কিছু থাকেই না, কারণ ভেসেলের গায়ে এডজে এত স্লো ফ্লো হয়। In small vessels, essentially all the blood is near the wall, so that extremely rapidly flowing central stream of blood simply doesn't exist. By integrating the velocities of all the concentric rings of the following blood and multiplying them by the areas of these rings, one can derive the following formula. This law is just F equals to pi delta PR to the power 4 divided by 8 eta L. Here, what is this means actually, delta P is the pressure difference. I actually defined it earlier. R is the radius, and it is the most important, this R, because the rate of blood flow is directly proportional to the fourth power of this radius. And again, that is the radius of the vessels, and which demonstrates once again that this is the half of the diameter of the vessels, So if it is say 4, that is radius is 4, fourth power means 256 fold rises of blood flow. And again you see this is eta. Okay, this is the viscosity of the blood, and viscosity of blood, when does it increases in case of polycythemia, also in case of dehydration, and decreases in case of anemia. And the length of the vessel mainly depends on the weight of the person. As you know, more weight, more will be the length. Now comes to total peripheral resistance, that is total vascular resistance. Now comes to total peripheral resistance. You need to know the peripheral resistance first. It is the amount of resistance faced by each unit of blood during its passage through the peripheral vasculature each minute, and if the pressure difference between 2 points is 1 millimeter and the flow is 1 meter per second, then the resistance is said to be peripheral resistance unit, that is PRU. Here total peripheral resistance, that is total peripheral vascular resistance, not pulmonary, we are going to describe. The rate of blood flow through the entire circulation is equal to the rate of blood pumping by the heart. It is, that is equal to the cardiac output. You know cardiac output, defined it earlier, we will be discussing later on again. In the adult human being, it is approximately 100 milliliter per second. The pressure difference from the systemic arteries to the systemic vein is about 100 millimeter. So therefore resistance of the entire systemic circulation is called total peripheral resistance. I have told you before, that is, what does F equals to? You see, here is, there's that law. F equals to delta P by R. So if I ask you, that is, here what happens? Here is the R equals to total peripheral resistance, R equals to delta P by F. So delta P is the pressure difference, where you can see the pressure difference, where it is, that is, the pressure difference is 100. So this delta P divided by F, which is F, this 100 milliliter per second. So we can say R equals to 100 by 100, that is 1. This 1 millimeter of mercury per milliliter per ml, that is per minute, is 1 peripheral resistance unit. In this condition, in which all the blood vessels throughout the body become strongly constricted, the total peripheral resistance occasionally rises as to as 4, and when it is dilated, it becomes 0.2, that is fall. So what happens whenever a vessel is constricted? You just press the edge of the vessels and it becomes narrow. When a vessel is narrow, more same amount of blood is flowing, so more resistance is developed. Okay, whenever it is dilated, less resistance is given. Now we are going to discuss a very important thing, vasomotor centers of the brain. I am going first. Vasomotor centers, here you see, this is the vasomotor centers. Where it is? It is located bilaterally, mainly in the radicular surface of the medulla and at the lower third of the pons. This is vasomotor center. This center transmits parasympathetic impulses through the vagus nerve, we will be seeing later on, to the heart, and transmits sympathetic impulses through the spinal cord and the peripheral sympathetic nerves, virtually all the arteries and arterioles. It mainly comprises some areas, vasoconstrictor areas and vasodilator areas. Now move on, you will see. This is vasoconstrictor area located bilaterally, you see earlier, in the anterolateral portions of the upper medulla. Remember, it is in the upper medulla, and the neuron originating in this area distributed their fibers to all the levels of spinal cord, where they excite preganglionic vasoconstrictor neurons of the sympathetic nervous systems. Now the vasodilator area, it located bilaterally in the anterolateral portions of the lower half of the medulla. The fibers from these neurons projects upwards to the vasoconstrictor area just described. They inhibit the vasoconstrictor activity of this area, thus causes vasodilation. Another area, sensory, actually what happens, the vasodilator area actually it just inhibits the functions of vasoconstrictor area, and this sensory area controls. It is located bilaterally the tractus solitarius in the posterolateral portions of the medulla and lower pons. The neurons of this area receive sensory nerve signals from the circulatory system, mainly through the vagus and glossopharyngeal nerve, and output signals from this sensory area help to control the activities of both vasoconstrictor and vasodilator area, jeta ami bollam, and thus vasomotor centers providing reflexes control mainly the circulatory functions. Example is baroreceptor for controlling this arterial pressure, আমরা যেটা আরো পরে জানতে পারবো। নাও আমাদের ব্লাড প্রেশার সম্বন্ধে বুঝতে হবে। ব্লাড প্রেশার সম্বন্ধে জানতে গেলে আগে ডেফিনিশন যেটা জানতে হবে, এটা কি আসলে। হোয়াট ইট ইজ blood pressure is the lateral pressure exerted by blood on the vessel wall while flowing through it. ওকে, দেখো এখানে ব্লাড প্রেশার বলেছি, arterial blood pressure can be defined, that is blood pressure, lateral pressure exerted by the moving column of blood on the wall of the arteries, that is the vessel, and this blood pressure equals to CO and TPR, that is cardiac output and total peripheral resistance. You know before what is cardiac output, what total peripheral resistance I just described earlier. So you know about the total peripheral resistance earlier, and cardiac output, amount of blood that is ejected by each ventricle, and in each, what about it, you know, I am not going to tell. You need to learn what is in each beat and what is in each minute, which one is cardiac output and which one is stroke volume. I am not going to tell you. Now comes the pressure in the aorta and the brachial artery and other large arteries in young adult human rises to a peak value of systolic pressure. As you know, there are some pressures I am going to describe you. Systolic pressure, that is 120 millimeter of mercury. Here is an example, and about and the minimum pressure is diastolic pressure, that is 70. So mainly there are four pressures: systolic, diastolic, pulse, and mean pressure. Systolic pressure is the maximum pressure during systole, that is 110 to 140 millimeter of mercury, and diastolic pressure is the minimum pressure during diastole, that is 60 to 90 millimeter of mercury. There are also pulse pressure, that is the difference between systolic and diastolic pressure. So you can get the difference is 50 millimeter of mercury. Another pressure is mean pressure. This is the average pressure. You can get it by adding diastolic pressure with 1/3 of pulse pressure. This way you can calculate these pressures. Now there are some questions. Before this next slide, I need to describe you totally. You need to read it, go through. I am just skipping this. The factors influencing the blood pressure, or the control factor that regulating blood pressure. Again, what is most important? Which one, systolic or diastolic? Diastolic blood pressure is most important because heart is pumping blood during diastolic phase, and if the diastolic pressure is more important because diastolic pressure is the level at which heart is pumping blood, and if the diastolic pressure is raised, heart is to do more work, so therefore it can be hypertrophic, so it can be leading to more pathological conditions. In this case, we can say diastolic pressure is more important, and you know the calculation of mean pressure, all that. Now this figure showing arterial pressure, that is I just discussed cardiac output and peripheral resistance. You have learned before cardiac output and we have already discussed peripheral resistance. Now comes to what are the regulating systems. This is the regulating system. Actually this is called, firstly I have described it, this is short term regulation you can also call, and this is the intermediate, and this is the long term. Short term mainly rapidly acting pressure control system, that is the controlling within seconds or minutes, baroreceptor feedback, central nervous system ischemic mechanism, and chemoreceptor mechanism. And next one is pressure control mechanism, that is acts by minutes, that is renin-angiotensin vasoconstrictor mechanism, stress relaxation of the vasculature, and the shifting fluid through the capillaries. And long term mechanism is renal blood volume pressure control mechanism and renin-angiotensin aldosterone mechanism. Now comes to baroreceptor. Students, I am going to describe you mainly baroreceptor and chemoreceptors, and the other receptors and the other mechanism I described earlier. Just you need to learn all this. So baroreceptors, these are the spray type nerve endings located in the wall of arteries. You see, in the wall of arteries, and they are stimulated when there is stress. A few baroreceptors are located in the wall of almost every large artery of the thoracic and neck region, but you have seen this, the wall of the each internal carotid artery, and also the, what is the pointer, internal carotid artery, and also in the slightly above the carotid bifurcations, that is known as carotid sinus, and the wall of the aortic arch. Carotid baroreceptors are transmitted through the, what is this, carotid is transmitted, here is this aortic baroreceptor, and the carotid baroreceptors, here it is transmitted by Henring's nerve to the glossophageal nerve in the hindly neck region, and the aortic baroreceptors you see here in the arch of the aorta are transmitted through the vagus nerve and to the tractus serratus, and thence to the medulla. Now I just described this earlier, carotid baroreceptor and transmitted, how it is transmitted. Now the carotid sinus baroreceptors are not stimulated at all by the pressure between 0 and 50 to 60 millimeter of mercury, but there is a but. Above this level they respond progressively more rapidly and reach a maximum about 180 millimeter of mercury. This response of the So the carotid baroreceptors are not stimulated at all by pressure between 0 and 50-60 mm of mercury, but above these levels they respond progressively more rapidly and reach a maximum at about 180 mm of mercury. The responses of these aortic baroreceptors are similar to those of the carotid receptors, except that are operated in general at a pressure levels about 30 mm higher. This para is just told is most important. You need to understand this very much. Now, especially in the normal operating range of arterial pressure around 100 mm of mercury, even a slight change in the pressure can cause a strong change in the baroreceptor reflex signal and to readjust arterial pressure back to the normal. So baroreceptor feedback mechanism mainly acts when the pressure rises, it brings the pressure to the normal level. Again, when it goes fall down, then it just inhibited and again helps to respond by bringing the pressure to the normal level. Now how it acts, we just see. Whenever you can see here baroreceptors, how it firstly act. Whenever pressure is high, there is baroreceptors enter in the medulla tractus suatus. Signals inhibit the vasoconstrictor centers of the medulla and excite the vagal center. What happens? Vagal center, so vagus nerve madhyame what happens? Vasodilatation of the veins and arteries and decrease heart rate and strengthen of the heart contraction. Strength of heart contraction and heart rate decreases. So what happens? Excitation of the baroreceptor by high pressure in the arteries reflexly causes arterial pressure to decrease. As you know, vasodilatation is there, so peripheral resistance is also decreasing, ultimately blood pressure decreasing. And again, when low pressure happens, what happens? When low pressure happens, baroreceptor actually it is not working at that time, it is inhibited, so decrease impulses to the brain and decrease parasympathetic activity. So whenever parasympathetic activity decreases, what does it happens? Heart increases its heart rate and contractility, then what happens? Cardiac output increases and again vasoconstriction. So what happens? Peripheral resistance increases and also there is some epinephrine and non-epinephrine ultimately helps in vasoconstriction and contractility, thus increases blood pressure. Now few things you need to know about also. Circulatory reflex initiated by baroreceptors. After the baroreceptor signals have entered the tractus suatus of the medulla, secondary signals inhibit the vasoconstrictor center of the medulla and excite the vagal parasympathetic center. Effect is vasodilatation and also decrease heart rate. And therefore, excitation of the baroreceptors by high pressure in the arteries and reflexly causes arterial pressure to decrease because of both a decrease in the peripheral resistance and also decrease in the cardiac output. Discussed it earlier. Now, functions of the baroreceptors during changes in body postures. When our posture changes, that we are in sitting or in lying posture, say you are in lying posture, suddenly stood up, what happens? The ability of the baroreceptor to maintain a relatively constant arterial pressure in upper body is important when a person stands up after having been lying down. What happens? Suddenly you stand up, your blood pressure should be fall, but not that happens because what happens? Immediately on the standing, the arterial pressure in the head and upper part of the body tends to fall, and marked reduction of this pressure can cause loss of consciousness. Now, so summary, we can say this: baroreceptor system supposes either increases or decreases in the arterial pressure, that is the pressure buffer, and the nerves for the baroreceptors are called buffer nerves. And the arterial baroreceptor system is to reduce the minute to minute variation in arterial pressure to about 1/3 that which would occur where the baroreceptor systems are not present. Now comes to chemoreceptor system, and you can see the chemoreceptors are chemosensitive cells that is sensitive to lack of oxygen and carbon dioxide excess and also hydrogen ion excess. They are located in several small receptors, small chemoreceptor organs. You see these pictures. This is the vagus nerve, glossopharyngeal nerve, carotid body, and the medulla. They are located in these several small chemoreceptor organs and about carotid bodies, one of which lies in the carotid bifurcations of the common carotid artery. Usually one of these is aortic, 1 to 3 aortic bodies adjacent to the aorta. The chemoreceptor excites nerve fibers along the baroreceptor fibers, passes through the herring. So what happens for the chemoreceptors? Whenever the arterial pressure falls below a critical level, the chemoreceptors become stimulated. Chemoreceptors become stimulated. Okay. How it happens? Because diminished blood flow causes decreased oxygen and excess buildup of the carbon dioxide and hydrogen ion that are normally not removed by the slowing of the flow. The signals transmit from the chemoreceptors excite the vasomotor center, and then this elevates the arterial pressure back to the normal. However, the chemoreceptor reflex is not a powerful arterial pressure controller until the arterial pressure falls below 80. I just discussed it before. Now, what happens here? You can see chemosensitive cells responding this. You see, partial pressure of oxygen decreases and pH decreases, that is hydrogen concentration increases, and also the partial pressure of carbon dioxide increases, causes stimulation of the vasomotor centers, ultimately causes increased carbon dioxide increased cardiac output, increased heart rate, and vasoconstriction causes blood pressure to rise. Now here I have two important things mentioned. There is firstly Kortkopf sound. What it is? The sounds are heard due to occurrence of turbulence in the flow of the blood through the narrowed blood vessels whenever a manometric pressure just coincides with the systolic blood pressure. Due to giving air pressure in the cuff, the vessel is pressed and blood flow is obliterated. But while releasing the air pressure gradually, blood just begins to flow through the narrowed blood vessels, and the pattern is changed from streamline flow, that is silent, to turbulent flow, that is noisy. When the pressure is further released, normal streamline flow sets in and no sound is heard. At this point, the pressure coincides with the diastolic blood pressure. As the pressure is released, the variation of the sound is heard. Here you see phase 1. You need to read all these phases from the books. I just mentioned this to have just to have the guideline. Listen to my words also. Firstly, sudden appearance of a clear tapping sound. This indicates systolic pressure. It persists for say the pressure falls average through 15 mm. This is phase 1. Then comes to phase 2. The tapping sound is replaced by murmur sound persisting for another 15 mm. And then comes to phase 3. This phase 3, the murmur is replaced by clear, loud gong sound, and this lasts for 20 mm mercury. And then fourth sound, this sound, loud sound, suddenly becomes muffled and rapidly begins to fade. This point indicates diastolic. This point indicates diastolic pressure. And fifth, absence of all these sounds is mainly fifth phase. Now I have mentioned here the method. Mainly there are two methods. I have written just auscultatory method, but there is also a palpatory method. Whenever you are going to do the practical exam, you will get to know. So in the auscultatory method, there is a sphygmomanometer, and arterial blood pressure is recorded by inflated Rivarosic curve, and the curve is rapidly inflated until this pressure rises to systolic, and then you need to know wherever is the brachial artery, and this way you can auscultate. Now this is an extra slide I have added. You can go through this: factors controlling heart rate increased by decreased activity of baroreceptor, and factors decreasing heart rate is increased activity of baroreceptors, vice versa. Then also heart rate increased by increased activity of arterial stress receptor. Exercise, আমরা এক্সারসাইজ ব্যায়াম করলে কিন্তু হার্ট রেট বেড়ে যায়। হাইপক্সিয়া, অক্সিজেন কমে গেলে, তুমি যদি নাক বন্ধ করে রাখো, অক্সিজেন কমে যায় তোমার শরীরে, তাহলে তোমার হার্ট রেট বেড়ে যাবে। দেন এক্সাইটমেন্ট, ইমোশন, অ্যাঙ্গার, ইন্সপিরেশন, ওকে, ফিভার, জ্বর আসলে কিন্তু আমাদের হার্ট রেট বেড়ে যায়, অ্যান্ড সাম হরমোনস অলসো। আর হার্ট রেট কমে যায় কিন্তু ইন্ট্রাক্রেনিয়াল প্রেশার বেড়ে গেলে। অ্যান্ড অ্যাগেন ফিয়ার, গ্রিফ, ওকে, you need to remember anger and fear, two different things. And grief, okay, expiration, painful stimuli, this causes decreased heart rate. So go through the books. Thank you all. Please go through the books.